dear President, dear colleagues, I'm going to talk about the obesity and microcirculation. This is my disclosure. First of all, I would like to notice that microcirculation and obesity remain an unexplored domain. So let me start with the terms. The term microcirculation refers to the function of the capillaries and the neighboring lymphatic vessels. 5% of circulating blood volume is present in the capillaries at any given time. This takes part into the exchange of nutrients, gases, and waste products between the blood and the tissues. How to measure microcirculation? I think it's a little bit difficult. The microcirculation can be analyzed non-invasively in humans either by direct intraviral capillaroscopy on skin, on nail fold, or by laser Doppler measurement. In animal research, these techniques can be used in relevant organs such as skeletal muscle, hamster cheek pouch, or mesenterium. Studies in muscles and particularly report an view of the suspected cardinal role of the microcirculation in insulin resistance and, of course, in the metabolic syndrome. Let me start with a definition of obesity. Obesity, as we know, is a state of excess adipose tissue mass. Medically meaningful distinction between lean and obese is arbitrary, so obesity is defined by assessing its linkage to morbidity and mortality. The cause for the obesity and the cause of the obesity is genetics does play a role in obesity. However, in most cases, both genes and behavior are necessary for a person to be overweight. Body weight, it is well known that is a result of combination of influences: genetic, metabolic, behavioral, environmental, culture, and socioeconomic influences. Therefore, behavioral and environmental factors provide greatest opportunity for action and intervention. Obesity, it's well known that it's a global epidemic. The prevalence of obesity measured by BMI has risen to unacceptable levels in both men and women, especially in the United States, but and worldwide. As you can see in these slides, the overweight and obese increase the risk of cardiovascular disease mortality. This data coming from a study from 1 million men 75 years old, following for 16 years, who never and had no history of disease at enrollment of this study. This is the proposed mechanism of obesity-related microvascular dysfunction predisposing to main organ disease. As you can see, high-fat diet on a regular basis changes the composition of visceral adipose tissue and induce a new great inflammatory response, which together modify the secretion of adipokines. From the other side, high-fat diet results in endothelial function through the body. Global microvascular dysfunction in obese patients is a common pathway for CKD, microvascular adhesion, heart failure path, exercise intolerance, COPD, pulmonary hypertension, and of course, microvascular dementia. Let's start to explain the reason why adipose tissue microvascular induced to obesity. Two main types of adipose tissue have been distinguished in the body, which have distinctly different function, both in healthy and obese subjects, being white and brown adipose tissue, respectively. White adipose tissue comprise both subcutaneous and visceral adipose tissue. The main role of brown is only the thermogenesis. From the other side, adipose tissue hypoxia and inflammation are centrally involved in the pathophysiology of obesity and can, through release of vasoactive and or inflammatory adipokines, modulate microvascular function throughout the body. Let's move now to another issue, the skeletal muscle and the microcirculation. Through some study in young adult humans suggest that skeletal muscle blood flow is relatively well maintained in obesity, even during exercise. Others show a reduction in flow normalized for muscle mass, both at rest and during exercise. However, the impairments in blood flow and its distribution are likely to become more severe with the presence of metabolic disturbances, persist in obese patients, especially with comorbidities such as hypertension or diabetes mellitus or coronary artery disease. What about coronary microcirculation in obese patients? Coronary microvascular function play an important role in coupling of myocardial perfusion to cardiac metabolism. Several studies have reported reduced coronary flow reserve and increased minimal vascular resistance in patients with obesity and dyslipidemia, as assessed by position emission tomography or Doppler echocardiography. In conclusion, both clinical and experimental evidence indicate that obesity is an independent risk factor for coronary microvascular dysfunction. This is an algorithm that show the obesity-related coronary microcirculation. As you can see, the obesity, due to increase the neurohumoral activity, leads to obesity-related hypertension. It is well known that obesity-related hypertension is due to volume overload and lead to cardiomyocyte hypertrophy. Of course, due to increase of neurohumoral activity in obese patients, we have the micro-5 infiltration, reduce and change endothelial smooth circle. And of course, diabetes with the same route go to the coronary microvascular dysfunction. It is well known that aging as a risk factor not modified, so also to the coronary microvascular dysfunction. What about cerebral microvascular and obesity? Obesity-induced change in brain microvascular structure and function have been proposed to result in disruption to neurovascular coupling, thereby leading to vascular cognitive impairment. The cumulative effect of cerebral inward remodeling, microvascular rarefaction, and impaired vasodilator capacity likely contribute to obesity-related impairment in brain, flow control, and neurovascular coupling. What about renal microvascular in obesity? Obesity is associated very clear with increased risk for chronic renal failure. The increased fat or lipid deposition in the around of the kidney acts as a promoter or inflammatory state with oxidative stress, endothelial dysfunction, and leads to microvascular remodeling. Although these changes are promising, are initially reversible by switching to healthy lifestyle. What about pulmonary microcirculation and obesity? These structural pulmonary microvascular changes in obesity resemble those found in post-capillary pulmonary hypertension. Indeed, the prevalence of pulmonary hypertension is increasing in obese subjects and is associated not only with sleep apnea, this is common in this patient, and hypoxemia, but also with the presence of left ventricular diastolic dysfunction, resulting in increased left atrial pressure, indicate so easy with echo, especially with tissue Doppler imaging. In summary, dear Mrs. Chairman and dear colleagues, obesity is well-established risk factor for microvascular dysfunction throughout the body. This microvascular dysfunction is likely initially by transient elevation of circulating free fatty acids and perpetual by changes in adipokines and inflammatory of cytokines released from visceral as well as perivascular adipocyte tissue. This factor contribute to endothelial dysfunction as well as insulin resistance in the microvasculature. Thus, although the mechanisms can differ between regional vascular bed, microvascular dysfunction is a central common pathway that may explain exercise intolerance as well as the higher prevalence of chronic kidney disease, microvascular dementia, coronary microvascular angina, heart failure with preserved ejection fraction, and pulmonary hypertension in obese patients. Finally, microcirculatory dysfunction is associated with many cardiovascular diseases state and seems to occur long before the onset of clinical symptoms. It's very important identification of this dysfunction with non-invasive testing may enable clinicians to identify those at increased risk of peripheral and cardiovascular disease. It may also allow for the quantification and monitoring of treatment designed to prevent or improve microcirculatory function. Thank you so much for your attention.